Hi, welcome. I am Brittany with Birth It Forward, certified birth and bereavement doula, certified yoga instructor, and family photographer. If you like this video, make sure you hit the like button and subscribe to our channel, and then share it with all your friends. All right, let's get started. Today, we are going to talk about questions to ask before an induction if you are having a hospital birth, a hospital planned birth. All my stuff. Okay, so one of the first questions, why do you feel an induction is necessary? I usually recommend asking this just so that you kind of get a feel for where your provider is thinking, especially if we're talking about this at 37, 38 weeks. Usually they will recommend an induction around 39 weeks, and that's based on a pretty old study that says babies are healthiest at when born around 39 weeks. Something to be aware of is a lot of insurance companies, unless there is a very clear medical reason, which we're going to discuss on the next slide, they won't cover the cost of an induction. They will cover it at 39 weeks or more, but not before 39 weeks. So some reasons why medically you might need an induction. Generally, if you're 41 or more weeks, especially at 42 weeks, you're becoming a post-term pregnancy, and that does have some higher risk factors involved that they would like to mitigate. So some other things to think about are some health conditions, such as high blood pressure, preeclampsia, or even full-blown eclampsia, diabetes, or some other high-risk complications that you may be facing regarding anything, really, any health issues. So you might also see some placental issues, maybe the separation of the placenta from the uterus, or maybe the placenta is failing and baby's fetal growth is restricted. Maybe baby is having some distress. Oh, sorry, I didn't fix that line under there, but maybe baby is showing some fetal distress, or mom is having some other health issues that are really pointing toward an indication that baby needs to come out. You might be seeing some amniotic fluid levels, whether that's high or low. Again, I didn't fix that one, but whether those amniotic fluids are high or low, that can also affect the health and stability of the pregnancy. So those might be some reasons why not we, but why they might recommend an induction. So some other questions. What are the risks of moving forward with an induction, and what are the risks of not moving forward with an induction? Now, based on your medical history and your risk factors, that is going to be a discussion between you and your doctor of not moving forward or moving forward. But some risks of an induction, risks to mother is you could have a failed induction. Maybe the labor is prolonged. Inductions can take some time, especially if mom's body isn't fully ready or if baby isn't fully ready. Generally, the development of the baby's lungs is what indicates that mom's labor is to start. So if labor hasn't started, there's a reason for it. There's something going on with you or baby. But that prolonged labor and induction does take time. It's often 3 to 5 days worth of from start to finish of induction to baby in arms. Maybe mom has an infection of some kind, or I'm so sorry, a risk is an infection, but an infection could be a potential sign depending on the infection needing induction. But anyway, so a maternal risk of an induction is uterine rupture. There are some really good information. There's really good information out there regarding what uterine rupture is. And if you're interested, send it in the chat and let me know. I will do a video. But you can get an infection. If and then there's hemorrhage. So induction medications can eventually cause a hemorrhage to happen. You can have some postpartum mood disorders, increased pain levels, increased anxiety and fear. This one's not scientific, as in they haven't done full research on it, but there are correlations that have found an increased risk of jaundice as well, which I didn't put on there because we don't have actual scientific studies. So some risks to the infant, fetal distress, a low heart rate, premature birth, and the potential for a cesarean delivery. So, what is your preferred induction process? This is a good question for your doctor, because doctors have different processes that they might prefer. There are several different ways an OB might go about doing an induction. Here are some tools that they might use. So medications such as oxytocin, which is also known as Pitocin, or the use of Cytotec, which Cytotec is not technically approved by the FDA for labor induction. However, it is very effective. Some women a have like, sorry, I'm drawing a blank on my word. Some people are more sensitive to Pitocin versus Cytotec. So just depending on which one they prefer. However, Cytotec is less expensive, and often used in other forms of labor and birth. So you can also see mechanical devices such as balloon catheters. Some of them, so you've got a Foley catheter or a Cook's catheter. A Foley catheter has two balls, one on the inside of the cervix and one outside the cervix, both putting pressure on the cervix. And a Cook's catheter has one ball, which is usually what they use. Ignore me. They can also use Cervidil and other cervical ripening gels or tools. They can do a membrane sweep and then some other non-medical methods that you can try at home: exercise, castor oil, power pumping. Each of these can take some time, especially the power pumping. That can take 3 to 5 days before you have enough oxytocin built up in your body. All right. So what's this typical dosage for Pitocin? They're probably going to start off with 1 to 2 milliliters. They usually increase by 1 to 2 milliliters every 30 minutes, usually in increments of 2 milliliters. And then most hospitals have a max limitation of 20 milliliters per use. So they will max go up to 20. As you can see in this photo, this mom was on 14 milliliters of Pitocin. Can I take a break from Pitocin and see if my body will begin labor on its own after a few hours? So usually, you can take a break. You can ask to take a break if you need to. So they're going to watch your monitor pretty closely, and they're going to keep track of the contractions, the strength and frequency. They do say that the monitors don't show the strength of those contractions, but they do show frequency very well. They're very on key for that. But they're going to watch that, and if they're becoming too close together, a minute or less, they're usually going to say, all right, let's either keep the Pitocin at this level or we're going to reduce it just a little bit to see what happens. Maybe mom or baby are showing some signs of distress, heart rate or blood pressure is increasing. Definitely heart rate for baby. That's the main thing that we monitor, or they monitor. I have seen monitored. And then there might be a time when you just need to allow the uterus and the body to relax. This isn't a very common reason for hospitals to reduce, but it is something that you can ask if you're like, I just need a break. I need a break. I need to be able to sleep. I'm too tired. So you can ask also if your body has been showing a really good contraction pattern. You can ask for them to reduce the Pitocin to see if your contraction pattern is staying steady, to see if your body will take over. So another good question: how long do you allow patients to labor with Pitocin before it's determined the labor has stalled or is indicated as a failure to progress? So let's talk about failure to progress. Some guidelines from the ACOG is the labor must be in active labor of 6 centimeters or more of dilation for it to be labeled as a failure to progress. So if you are 4 centimeters, that is not active labor, which means you cannot be called a failure to progress. You can't be diagnosed with it. And then for Pitocin use, if you've been on Pitocin for more than 6 hours, and you aren't really having good uterine activity, or you're not dilating, then you can be labeled as failure to progress, and they might start talking cesarean at that point. So some good things to do. What are your options? Hopefully you start some movements. You do position changes prior to being labeled failure to progress. We want to do everything we can before we get to that 6 hour mark. But a big question is, are your amniotic fluids ruptured? If they are, we have to stay and complete the labor one way or another. Because after 6 to 12 hours, you have a much higher risk of an infection setting in, and that's not good for you or baby. So if your amniotic fluids are not ruptured, you have the option to say, look, it's not working. Let me go home and we'll come back and do this another day. You can totally stop the induction. You do have the option of staying and continuing with the induction, whether your amniotic fluids are ruptured or not. So if they are ruptured, are there any signs of infection? If not, you can ask to take a break from Pitocin. You do want to keep in mind that the longer your waters are ruptured, the higher your risk for an infection is. But sometimes your body just needs a break. Maybe your mind needs a break just to reset. So let's lower it or take a break. They don't like to lower it all the way or turn it off because then we have to start again at 0. So they like to lower it in increments rather than just turning it totally off. But you do have the choice to say turn it off totally or just lower it. Have you used any pain medication? If not, you can try. I have seen lots of moms who decide, okay, we're getting to that point where we're just not showing progress and I can't relax. I'm exhausted. I'm tired. Maybe we try some pain medications. We've tried every other position and comfort measures that we could think of, and we're still not showing any progress. Pain medication can help with that potentially, of allowing mom's body to relax and let the contractions do the work of moving baby down and into their correct position. Attempt to get a nap as best you can. Find some way to relax your body, get a nap, reset yourself, and then get back into it. The last option is a cesarean. Unfortunately, it's not funny, but unfortunately it is. It is the option that a lot of doctors are going to come back with. So they're going to say, you are failing to progress. The labor isn't continuing. We need to go to a cesarean to get this baby out. And that's a discussion that you can definitely have. Be prepared for. So thank you for joining me for this talk on questions to ask before a hospital induction. If you have any additional questions, you can hit them in the comments or send an email to contact@birthitforward.org and someone will get back to you. Also, we provide lots of doula services and education, so holler at us. You can go to our website of birthitforward.org and sign up for your doula today. Have a great day.